Thank you, Dr. Deepamala and Dr. Poonam Chablani and those who attend the Hindi session. Good evening, good afternoon, and good morning. This is the 1915th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Sisir, PS. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's our guest. It is Professor Dr. P.R.Sisir. She has completed MD in homeopathy and is the professor, head, and research guide in the Department of Pediatrics and Center for Research at Sharda Krishna Homeopathic Medical College, Kulasekharam, Tamil Nadu, India. And he has more than 30 years of clinical experience. And he has presented several papers in this forum earlier. And he has taken a very recent session at Malayalam Zoom on Children's Day. So today, Doctor will be discussing about a very important subject, that is management of thyroid problems in children with homeopathy. As we all know that the number of thyroid cases are increasing day by day, and people are running around for treatment in different categories. But we all know that most of the people are taking excessive iodine salt, but still the condition is worsening. That means that this is a wrong concept that we giving all this iodine to everywhere and everyone. Let us discuss what are the things that affect children and how it can be managed with homeopathy. We proudly invite Professor P.R.Sisir. Welcome, sir. Please unmute and you can please unmute. Yes. Once again, please unmute once again. Your co-host. Okay.
Good evening, all of you.
Yes.
Am I audible, sir?
Yes, everything fine.
Okay. Welcome to all of you. I am from Kerala, Trivandrum. I am working as Dr. Danesh sir has told, I am working for the last 25 years in Sharda Krishna Homeopathic Medical College, which is at Kanyakumari, Tamil Nadu. I am in the Department of Pediatrics and also handling the pediatric cases in pediatric clinic at the same college at hospital. Let me share my presentation.
Yes, you can. Yes, visible.
First of all, let me dedicate to all the homeopaths over here to our master, Dr. Samuel Hahnemann. So today the topic is, as Danesh sir has told, it's a continuation or a repetition of the Malayalam session which we had during the Children's Day on November 14th. Thank you, Dr. Danesh sir, for giving me opportunity to once again present this on a larger platform, and that is for the English presentation. So as told during the earlier session, IFPH, which is a boon which homeopaths started getting as a part of the COVID. As I told, that COVID is something which is a boon for homeopathy in two levels. One is for the publicity of the homeopathy through the medicine arsenicum album, which even a small child also knows that arsenicum album is an effective medicine to prevent viral infections like COVID. And the plus or the adding thing to the COVID is nothing but this platform, that is IFPH, which started during the COVID period. So it has reached 1,900 plus days. And I think this is now 1,915th session. I hope so. And thank you all, the organizers of all are my friends who are in IFPH. So I thank personally to all of you for inviting me once again to the session. And a small pardon from my side because today I was feeling not well since today morning. I had a small cold and sinusitis today. So sorry for that. And I may not be able to completely execute this for the exact 1 hour which Dr. Dinesh is saying. Anyway, I will try my level best to me because it is very cold and I had to got exposed to a cold, rainy for some days before, and now I'm having that cold. If my sound is not clear, please tell me because I'm not able to.
Everything fine, sir. You can go ahead.
Okay, sir. Thank you. Thank you very much. My gratitude once again is for my institute management, that is our Dr. C.K. Mohan sir, and the entire trust members, and the entire faculty members, my PG scholars, those who are with me for the support of my treatment in this magnificent institute. And significance of today's topic is, as Dr. Danish has told, it is about the thyroid disorders in children. It's not able in one session to completely tell everything about the thyroid session. But the beginning of the topic, I plan to present this as a small introduction as an academic part. So some of the doctors may not be knowing about the thyroid details. So as far as our pediatric is concerned, we start everything from embryology. So let us start about the thyroid glands from the embryological level and go to the clinical presentation of one or two cases. As I told, many of you may not be aware of the fetal development connected with the thyroid. That's why I'm going to this. I'm sure that many of you are expert doctors and well-known, maybe thyroid specialists also may be there in this group. But it's not fair to start a program without having a small introduction about this particular condition. Before that, a small level of fetal development, which many of you may not be knowing, let me present. The fetal thyroid, it's a bilobed shape and is recognized by the 7th week of gestation. Imagine this known to have its present the 7th week of gestation, and characteristic thyroid follicle cell and colloid formation is seen by the 10th week. So such earlier level itself, the thyroid follicles will be available and iodine trapping occurs. Iodine means the most important element that is required for the secretions and the development of thyroid gland. The trapping starts from 8 to 10 weeks. That means the mother may be consuming something connected with the iodine, and iodine needs to be trapped with the thyroid gland for its production and also for the purpose of its development. So thyroxine, which we call as T4, to a lesser extent, and iodothyronine, which we call as T3, synthesis and secretion occurs on 12th week of gestation. So these are the things connected with the fetal. 7th week, the gestation period, we can recognize its presence, and 10th week onwards, it starts trapping iodine from the mother's blood, and from the 12th week onwards, the thyroxine and the triiodothyronine synthesis starts in the fetal level itself. Hypothalamic neurons synthesize. Hypothalamus, all of you know, it is above the level of the anterior pituitary. Its neurons synthesize thyrotropin releasing hormone, which is known as the TRH, by 6th or within 8th week. The pituitary portal vessel system begins development by 8 to 10 weeks. Unless a pituitary portal vessels develop completely, things cannot reach a hormone. And TSH secretion is evident by 12th week of gestation. Occurs over second half of gestation, but normal feedback relationships, all of you should know that there is a feedback relationship between the entire system, that is pituitary gland, that is especially the anterior pituitary gland and the thyroid gland. There is a feedback mechanism which will be giving a stimulus whether thyroxine should be secreted sufficiently or not. Its presence in the blood is identified, and that feedback mechanism we all studied during our academic years. Approximately the third month of postnatal life, the relationship will be complete. The main function of thyroid gland is to synthesize T4 and T3, which I told earlier. And the only known physiological role of iodine, that is, iodine is in eye, all of it is iodized form, synthesis of these hormones. The main physiological role of iodine is in the synthesis of T3 and T4. The recommended daily allowance, everybody should be knowing, as a physician also should be knowing. Recommended daily allowance of iodine is 30 micrograms per kilogram, 24 hours for an infant. Just note that point, those who are interested. 30 micrograms per kilogram in 24 hours for infants. At the same time, for a child, it is 90 to 120 in 24 hours. That is in one day. 24 hours in one day, so much of iodine is necessary through the diet, not by what we call as iodide salt and all. And 150 micrograms for an adolescent and adults. So when the child becomes an adolescent after 12 years and all, the 150 microgram is necessary through the diet. Whatever the chemical from ingested iodine eventually reaches thyroid gland as iodine. Whatever may be taken through your diet which contains iodine, finally it reaches the thyroid gland as iodide. Thyroid tissue has an avidity, that is, it is an affinity for iodide. That's the peculiarity of thyroid tissue. It catches or we call it the trapping. It traps the iodide with a gradient of 100:1. That means if 100 molecules of iodide passes, at least one of its part will be uh, uh, trapped by the thyroid tissue, and the concentrate it in follicular lumen for synthesis of thyroid hormone. That is the physiological aspect. So thyroid that we take, iodine that is consumed through our diet, it is trapped by the thyroid tissue for synthesis of thyroid hormone. Entry of iodide from the circulation to thyroid is carried out by sodium iodide symporter. That is just like a vehicle. Now, let us see what are the thyroid hormone increases. Thyroid hormone increase. What are things that will happen in the presence of thyroid hormone as a metabolic aspect in our body? It helps in oxygen consumption, stimulate protein synthesis, influence growth and differentiation, and affect carbohydrate, lipid, and vitamin metabolism. See, generally we see so many problems, metabolic problems in a child or an adult when there is a problem of thyroid gland. And that these are the things that will happen. Oxygen consumption becomes less, Sometimes it so happens the protein synthesis simulation also gets reduced, and certain metabolic disorders as a whole will happen to the body. That's why thyroid secretions are important for the entire system. Thyroid is regulated by TSH, as all of you know, thyroid stimulating hormone, a glycoprotein produced and secreted by the anterior pituitary. And this anterior pituitary itself is stimulated by the hypothalamus. This hormone activates something known as the adenylate cyclase in thyroid gland and is important in all steps of thyroid hormone biosynthesis, from trapping of iodide to the release of thyroid hormone. This particular hormone is activated by this material. These are all for what we call it as academic importance. TSH synthesis and release are stimulated by TSH releasing hormone, that is TRH, which is synthesized in the hypothalamus and secreted into the pituitary gland. Pituitary gland thereafter produces thyroid stimulating hormone for the purpose of production of T3 and T4 sufficiently for the body. So that is all about the theoretical aspects. I hope so all of you have understood about that part. I'm not going to details as we are facing a big audience, I hope so, who are all aware of the thyroid need in the human body. So directly, as the thyroid cases of a pediatric, is an 8-year-old girl from our place, that is Kanyakumari. And the complaint presented by the parent is that the child is putting on weight since 2 years, and the child is also simultaneously constipated with bleeding on occasional stool, and at the same time, the constipation is not like what we call it as a tight stool. The soft stool is there, pass without difficulty. Constipation is a common terminology where the stool may be going smoothly, but the parent may feel that it is not going daily. That will be considered constipation. The stool is not passed properly, it is constipation. The stool is very hard, it is constipation. So many such varieties of constipations are. As far as this child is concerned, for the last 2 years, with the bleeding of one passing stool is also a complaint along with the weight gain. Let's go to the presenting complaint history. The patient complains of difficulty in passing stool, and she was passing stool once in 2 to 3 days. This presenting complaint history, remember that. It is weight gain. As a child has chronic constipation and weight gain, TFT was done before a week. That means the patient has come to our hospital into the clinic with a TFT report, which is having a TSH value of 62.49 ml. So all of you are aware of the normal value of TSH, and we'll go to the further details of this patient, and we'll see the real TSH value when we go to the lab investigation report in the coming slides. Nothing relevant as far as the previous illness and family illness is concerned. As usual, there are physicians who will take importance for the life-space investigation of the patient, where we'll go through the entire life of the child since birth, or sometimes it so happens that we may go even into the mother's pregnancy period also. Especially, we give so much of importance for so many cases in the first trimester of pregnancy, and that will give us a lot of information about certain things which will help us in our prescription and carrying out the case. That's a normal routine in our OPD. When we take a chronic case, and if the child is having certain disease situations, we give so much of importance for the first trimester of pregnancy and whether the mother has come across any issues during that period. So this patient is an adopted child. So that is why you can see that in the history of the family, no, not available, it is written. So this is an adopted child. After 10 days of birth, the child was adopted by the parent, which she has now. So the parent has brought to us an adopted child. There wasn't any developmental delay so far, and the child was vaccinated properly. And Child was good in studies. Physical generals, as we all give importance homeopathically, normal diet, decreased thirst even though the child is taking 1 liter of water daily. Sufficient number of hours sleep is there. Irregular bowel habits, as we told earlier in the previous slides, with bleeding and all. Normally, urine output and sweat is increased on the head. As we are all expert homeopaths, some of the points are indicating towards some medicine. So please don't jump to the medicine unless we complete the case. But expert doctors, when they come across certain points, they will come across the drug also and will start prescribing in those points. So now the picture has become more clear about a drug. Desire for meat, egg, pastries, curd, aversion to milk. So meat is there, egg is there, pastries, as nowadays children are very interested in pastries and all. Desire for curd, desire for curd is a good habit as far as myself is concerned, and for the milk also, as we give so much of importance for pre and probiotics in the diet for children who come after a lot of antibiotic prescription. Curd is now a very important dietary requirement for children, and there is aversion to milk. Aversion to milk is quite good, I hope so. And now coming to the constitution, physical makeup. This hydrogenoid constitution, thermally it is chilly and temperament is sanguine. So now also it is more clear about the plan of treatment. Mental generals, slow in activities, easily mingles with others, and the child, as we told in the presenting complaint, intelligent boy. Intelligent child. Generally looks chubby with 34 kg. So that was a presentation by the parent, no? So putting on weight for the last 2 years. And BMI is 20.8. No other problems connected with anemia, lymphadenopathy, and pulse and all normal. Systemic examination, mild discoloration around the neck, no scar marks. That's a systemic examination, nothing more has been identified. No tenderness, no nodular swelling, no local warmth. A particular physical examination specify here. No, that is taken. Slow in activity, intelligence, soft stool, bleeding while passing stool, profuse sweat, thirst, decreased aversion to milk, desire meat, curd, constipation, weight gain, thermal chilly. Slow in activities is the totality, intelligent, profuse sweat on head, decreased thirst, aversion to milk, all these points. AFT report dated on 18/8/2022 is 62.49, which was brought by the parent. Could have come across the remedy as calcium carb, and calcium carb, as we all know, it is a chili remedy. We can go for that. And third is sepia, and the fourth is lycopodium. As entire coverage is there for sulfur and calcium carb, and sulfur is a hot remedy, as we know. Calcium carb is prescribed. Even though calcium carb is prescribed, there is a plan of treatment, and that plan of treatment we may write down, which we all identified from the beginning, including the hypothyroidism indicated there. 1 mark is there for that also in the interpretation. So we have gone for that. Calcium carb prescription. These are the remedies which came up. The calcium carb, sepia, sulfur for academic purpose. That's a pharmacological picturization. And on a particular day, once we identified that all the medicines are all the totality is coming towards calcareous carb. From the very beginning itself, we have given calcareous carb 4 dose, once in a week. Why? It's a rhythm of prescription while prescribing certain potencies. So when we find that when calcareous carb 200 is prescribed, that is our experience level, we used to do this. Maybe there are doctors who may say that why do you want to repeat this frequently? That may be the rhythm of prescription that we maintain in my OPD is like for 200 we used to prescribe 4 doses weekly once, and if it is improving we will be reducing that uh, uh, doses. And that rhythm of prescription, the follow-up of this case in 1911-22, no further weight gain has been identified and calcareous carb was prescribed again in the same manner. And
As we all know, the thyroid problems are on the rise, and people are running and rushing towards all doctors to get it relief. But naturally, most of them are reaching at the allopathic doctor's side, and what they will is just give some medicine, and once they are diagnosed as thyroid problem and disorders, then naturally they may have to take medicine for the lifelong. That's the problem. But if a patient is coming to us consulting a homeopath, uh, we can gradually decrease the doses, and we can stop medication once the patient is back to health. That's not one thing. Nobody could believe that such thing can happen with homeopathy. At several times we have seen such successful cases in our clinic. The guest is not joined, so please wait. It may be due to some network problem. There are some heavy rain. I'm inviting Dr. Madhavi Ambadi to say a few words on this. Ambadi doctor, are you there? If possible, kindly. Oh no, you are not able to speak.
Yes.
Network
Yes.
is okay, no problem. Network seem to be weak. That's the reason why we can't hear you properly.
Doctor, am I audible?
Yes, yes, audible, audible.
Yeah, I'm sorry that there's a net problem with
Yes,
my
this we can expect
system.
that.
I don't know whether from where things have
You have
started.
just please open
I
eyes.
don't know what from which slide onwards. I'm not sure whether
Yes,
this was
yes,
the
you
slide
may.
or the previous of
This is the
this
first.
slide or this one.
You are just entering into the. You're just opening the your
Whether
computer.
my sharing is available over there?
Yes, yes, but it is stuck on there.
Your sharing is not available there.
Yeah, yes, sharing is there, but you need to open the computer. Just only the first part is there. You may
Your
do one thing.
screen is shared.
Yes, you may do one thing. You may stop screen sharing
Ah,
and restart sharing. You may stop that,
okay, okay.
then restart again.
Shall I restart that once again?
Yes, yes, you can share it now. Yes, now it is. Please move downwards. It is a prescription. Follow and calcaria carb 200.
Yeah. Calcare carb is a prescription. Am I audible?
Yes, you can go ahead.
So on February 23, the TSH has come down to 3.12, and calcare carb has come with a sufficient gap, which we never expected. And the case was restudied because the TSH has gone up. Even though the patient has come after a break, we studied the case again. And we see that calcare carb was a remedy again, and there was no change because the picture was very clear. Only thing that the child didn't come back on time, or the prescriptions were not taken by the child properly, and our medicine was clearly acting. And by 10th of 23, you can see that once the calcare carb prescription has been raised from 200 to 1 the prescription you can see over there on 14/10/23, it is 1 again, and the weight has gone up to 37.2, and 1 is acting, and we hope so, and the 3 TSH has come to 3. And you can also see the generalities has improved, and on February 17, we can see that the constipation is better. Weight has gone up to 39.5. See, over a period of time, the weight has gone up, that is sure. Calcare carb 1 4 dose once in 15 days are prescribed in this case. And the patient continued treatment since 17 February 24. The 39.5 kg stool was regular. Calcare 1 once per month has been prescribed. You can see those who have a mobile phone with you can see the prescription. I mean the lab report over there. Lab report is showing the difference in this previous. This is the first slide. You can see that is the protocol of the laboratory quite high. They will check once again. It is again rechecked and found that is 76.92. They have gone to a different lab outside. Picture over there. So this is usually done when we find that if there a doubt arises either by the patient or by ourselves, we will recheck it outside, and you can check the date over here. By 4/11/23, it has come down. Shall we go to the next case? One more.
Yes.
So this is another case of thyroid disorder, entirely opposite type. 10-year-old female child of second standard of our Kanyakumari district itself. And this patient came to OPD with pain in upper and lower extremity since 3 years. That was a complaint. Pain. Recurrent cough with expectoration, later diagnosed with thyroid disorder. Usually children come with pain of the lower extremities, and we sometimes we have a tendency to prescribe Rustox and Bryonia, or some with their modalities we may prescribe medicines. There is something known as the growth related factor for children, and they may come with pain for such matters. We have to advise them for taking proper proteinaceous diet so that their pain will be, because the growing pain is always there with children, and some children will present with that. Sufficient amount of calcium, phosphorus, minerals are also necessary in such children, and we have to check the vitamin D in some cases also. And nowadays we see that in many cases vitamin D deficiencies are there, and we used to tell them for prescribe them. I actually call that as a prescription, telling the patient child to play outside and not always inside. The children have a tendency for always sitting inside nowadays, and vitamin D deficiency in many cases are there. We have enormous numbers of cases where vitamin D is deficient. If vitamin D is deficient in a case, surely there will be calcium metabolic disorders also will be there. We need not even check the calcium also. There will be problem with the child in calcium level. And once the vitamin D is corrected, especially through the diet correction is more important than prescribing a what we call as the so-called vitamin D. And even cod liver oil, such prescriptions can be given with the support of physicians, and that will give, if it is too much problematic for the child with deficiency, we can think about that. But the first preference would always be for telling the child to play in uh, quite good sun exposure. And number two is improving the diet. Mushroom is a very good vegetarian diet. Good mushroom, edible good mushroom is a very good content of vitamin D. So such diets can be given first. In spite of not improving with the diet, our medicine will usually give a lot of improvement in assimilation of whatever is taken into the body, which other systems of medicine cannot do. A deficiency can be corrected with our medicine, with our constitutional medicine, where assimilation will happen properly. So that also is a boon for homeopathy. So here we have a child with lower extremity pain and cough complaints, and later diagnosed with thyroid disorder. So you can see that here also gaining of weight, and as the child, whenever a child unexpectedly find that they go for a obesity or putting on weight, always you have to check the constitution of the father and mother, especially the mother's family members also. Then we have to think of going for a investigation further, because jumping into investigation, especially like thyroid, is not always indicated. We take the female, I mean the female side, that means the mother's side properly, and then the father's side also to some extent. And if there is a tendency for a familial putting on weight during a period, then that is the reason we need not go. But here we find it is not like that. We send for thyroid function test. More point is written over there. Diagnosed with thyroid disorder. You can see the history of the previous illness. 11 months of age. Intestinal obstruction was present. History previously there was intestinal obstruction. We are not sure about what was obstruction. It may be intussusception or any such type of problems, in which some allopathic interference has been done and is relieved. There's a family history of hypertension and diabetes mellitus, and maternal grandfather is hypertensive and paternal grandmother is also hypertensive. See, there is a big tendency for this child who is going to become obese to become a hypertensive child in due course. So we have to be very careful. Precocious level issues may happen to this child in due course. So we have to tell the parents for controlling the diet and do proper moderate exercise. The child is having desire for sweet, cold food, non-vegetarian, intolerance to fanning and covering. See that intolerance. Usually, such children may get tolerate and they like fanning too much, and intolerance to covering is also there, and intolerance to cold season is also there. Built up is obese, and the height is 123 and the weight is 37.8, BMI is 24.98. Steady gait, no other problems in walking and all. Even though the child is presenting with some lower extremity disorders, pain and all, there is no problem in walking. You have to make the child walk and see whether there is any problem. Barefooted walking is very important when we are making the child walk. And preferably children of this category, we have to, they may come with genes and other things and all when they are coming. We have to see that their walking is properly, proper gait is there by removing the trousers and see, make them walk conveniently. If they have any shyness, we can take them to some other area, but it is mandate to see that whether they're walking properly, whether any walking gait deformities are there, may not be identified by the parent, but it is our responsibility to see that such things are identified, because it's a case which has come, and when chronic case is taken, all these things are to be considered. Yes, that is not a very difficult thing. When the child walks into the clinic, if you're observing very nicely, we can see that the child is comfortable. As Dr. Kent and others have said that we have to start a case or observing a case when the patient walks into the clinic, and keep observing completely. And once the child or the patient walks out of the clinic, the case taking continues. That process of understanding can be there for every case, and even for a child also. You can see the lab investigation report of this girl. In this case, T3 is, while comparing with the previous, you can find that the T3 is higher, and T4 is 13, and TSH is quite low. That is a feedback mechanism. You can see that TSH is very low because T3 is producing too much of T3 is produced. There is no responsibility for the anti-pituitary to produce more of stimulating hormone. Therefore, it is found as 0.01. So this case was prescribed with a peculiar remedy which you may not be knowing, or many of you may not have come across, or many of you might have given. And this I am presenting because for the awareness of every person who have come across thyroid disorders and have never prescribed calcareous iodide, this case is prescribed with calcium. Sometimes it so happens that two things we give to a thyroid, especially we have a thyroid clinic in our hospital where we have a lot of improving reports with certain drugs. I cannot say it is a specific drug and all, but calcareous iodide has saved so many cases from not taking the allopathic or the so-called hormone tablets for a long period. We can taper the drugs. Another thing which we always give, not in every case, especially in adult cases who come after a lot of allopathic medication, especially the hormonal treatment for thyroid, is the hydrastis tincture sometimes given. Those who believe in giving tinctures and those who support tinctures can think about that. Others, please don't go for that. There are so many varieties of prescribers, that in homeopathy. Some are so classical that they will prescribe the most similar remedy to the patient, and they do not repeat frequently. That is one school of thought. And some school of thoughts will repeat the medicine in a rhythm level. And some have the prescription manner by prescribing different scales of potencies. As we know that last period of Hahnemann's life, Hahnemann, even though started from a tincture, that is cinchona, finally in his last practice stages in Paris and all, he prescribed more of 50 millisiemens scale potency that we call the zerobar potencies, and was very successful. And we have to think of Dr. R.P. Patel, who gave us a lot of information about the zerobar potencies. In our hospital also, we give a lot of zerobar, the 50 millisiemens scale potencies with success. So that scale of potency also, some doctors will maintain as 50 millisiemens scale potencies. Every practice has got its own importance. And 50 millisiemens scale potency, as far as myself is concerned, in my OPD, I prescribe sulfur zerobar potency for skin complaint, zerobar 3, not frequently. Two drugs are very dangerous as far as I have understood for a skin complaint. One is sulfur and other one is graphitis. My chairman, Dr. C.K. Mohan, also has told about this particular point. That's why I am emphasizing on that. Sulfur zerobar potency, even though zerobar is said to be a potency by Dr. Samuel Hahnemann as very safe, but we found that, especially I personally found that zerobar 3, if you are repeating it frequently, especially in hypersensitive patients, especially children, we have to be very careful. Though I never prescribe zerobar 3 for a long period. I just prescribe only one dose for the first, especially for the first time. And graphite is also another remedy in serovar potency. Even I'm telling, even in serovar potency, we find that it creates a lot of homeopathic aggravation, maybe. Anyway, serovar potency is also very, very important for our children. Another serovar potency which I prescribe for certain cases, I'm telling just my experience only in this level, what I remember. Arsenicum album serovar 6 potency is a frequent prescription for every acute bronchitis cases. Arsenicum album serovar potency. How it is given is I will tell you. Serovar 6 potency, 1 globule medicated in 10 ml distilled water, that is aqua, and is given to the patient as depending on the age 10 drops or 5 drops in close interval. Especially such cases we admit in our IPD and then only we prescribe, because as it is a case which needs attention, especially acute bronchitis with severe bronchi and other things, you have to very carefully admit the case and prescribe accordingly. So serovar 6 potency, one dose means that 50 millismol, that poppy seed size globule, 1 globule in 10 ml aqua. And every time when we give 10 succussions. That is the standard thing that we give when serovar potencies are given. And the succussion is also very important, which we found in our studies. Every time when we have to activate that. Succussion is not the word I would use it. You have to activate by just giving some few what do you call the succussion that we do. You can maintain this 5 succussions or 10 succussions according to your need. Anyway, whenever we prescribe a second time the same aqua medicine, we have to do that particular activation of the drug once again and give. It will give wonderful results. And we especially tell the PG doctors and the nursing staff over there to do that. And if the patient medicine is taken home, we tell the bystander or the mother to do that, and we'll teach them how to do that succussion properly. And that has helped, especially in arsenicum album, for acute bronchitis. You know, acute bronchitis is a very difficult situation. When it's taken to allopathic hospital, they will go for giving O2 and all. We also support patients in our IPD by giving nebulization and all. So in this case, coming back to this case, calcare iodide 30, calcare iodide, please note this point. Those who have any case of thyroid disorder could not be cured or could not be controlled with your constitutional medicine or the so-called medicines. Think of 2 medicines. One is calcare iodide. Potency is your own decision. And one more medicine which I would like to add as an experience from a thyroid clinic is hydrasis tincture for difficult cases. Not for everybody. Those who do not believe in giving tinctures, please do not give. And this is a please bear for the wrong ages and all that is given over there. You can see the patient's name over there. You can see that is again rechecked because it is serovar 1. And you can see that it is above 180, 237, which is indicated this is a case of hyperthyroidism. Hypothyroidism was the previous case, but this is hyperthyroidism. You can see that the prescriptions are from 30, we have gone to 200, and you can see that 170, 155, and the patient's weight is 37 in the third follow. When we prescribe our medicine, simultaneously we have to think about diet of the patient. The diet is a very important factor, and diet homeopaths, if you are very much expert in telling the diet, it is well and good. As we have a setup in our hospital by of a nutritional is that we send the patient to clinical nutrition, which is available in our OPDs every time from daytime, full time, and they will also go to every IP cases. They will visit every IP case and prescribe diet according to the patient's need. Of course, that whatever is given to the patient should be available in that particular area. Don't prescribe something that is not available in that particular market also. So that is how we have to send the patient. So calcare iodide was continued, and you can see the report on 1st of January 23. It has come to 166. It has gone up to 166 rather than, and you can see the weight over the 38.3 kg. Calcarea iodide is still continued. 1 dose per week. That is a frequency of prescription. So we are coming to the cases report 170. So whenever we see that the TSH is coming up, it is indicating that the T3 level is also changing. T3 has gone up to 166. And over a period of when the patient comes frequently to our OPD, we'll see that everything comes normal. That is a very important thing that you have to keep it in your mind. 74.21 is the normal. It is in between the reference range. You can see that everything has come down to normal. So this is what I want to, because homeopathy is not only for hypothyroidism, homeopathy is also for hyperthyroidism also, and we prescribe and we come across cases which have a thyroid level immunological disorders are also there. In such cases also, calcarea iodide has helped a lot in so many cases. Calcarea iodide 30 200. I have never gone to 1 so far. 30 and 200 itself was sufficient for the case. So the next doctor, I think I have come to the end of the presentation. Hope I was audible for the entire
Yes.
presentation, and keeping my health in mind, please pardon me for not coming to the up to the mark of what your expectations and all.
There
Please.
was everything went in a good way, sir. There is nothing wrong with your presentation, and nobody felt that you have some fever or something like that. It was just a normal flow, just like fluent river. That's what. In between, there was a problem due to
Okay,
network.
net problem was there. Net.
It was not your mistake. Anyway, both the cases were really excellent, and this is how a homeopathic doctor need to go in to take the case and move forward to win the result. And your potency selection was also excellent. In the first case, you just gave 200 and then repeated calcarea carb with 1 and then once you got the result, you just stop it and then wait for the result, and you got the result at last. And in the last case, calcarea data, also you just done in that in a different way, and where also you got the remedy, you got the result. That means that a homeopathic doctor shall take the case in a better, in a good way, then collect the symptoms and then find the rubric and then choose the right remedy, and then you prescribe the right, choose the right potency, then you will get the result. That's what we gain from this presentation, whether it be a child or uh, adult, it doesn't matter much. What matters is a real case in front of you. Am I right, sir?
Yes, sir. Yes, sir. Yes, sir. Sure.
Yes. Yes, now I am inviting Dr. Manoj to say a vote of thanks to the session as the
Oh,
time
Manoj
is.
sir is there. Huh? I couldn't meet him.
Thank you, Dr. Ganesh and Dr. Sisir,
Sir.
for this presentation. And especially when you are coming from the college, that will further encourage the students, even though they are not participated. That is the need of the hour. Because all the college should take their own way, their own role to enhance or promote homeopathy. On behalf of IFPH, I expressing thanks to Dr. Sisir as well as those who participated in this session. Thank you.
Thank you. Thank you.
Thank you, Dr. Manoj, Dr. Sisir, and those who attend the session. And tomorrow we will have a session from Dr. Ruta Dev. So